Borderline Personality Disorder by Megan Podolsky. What is borderline personality disorder? Borderline personality disorder is defined as a personality disorder that is characterized by an ongoing change in moods, behavior, and perception of self. These result very often in intense problems in relationships and compulsive actions. People with this disorder could have bouts of depression, anxiety, and anger that could last anywhere from hours to days. People with this disorder may also view things as black and white, or all good and all bad. Their views about people may take a full 180 from one day to the next. How much of the population has borderline personality disorder? 1 to 2% of the U.S. population has borderline personality disorder, or about 4.5 million people. Women are more likely to develop this disorder, with 75% of those diagnosed with this disorder being women. What are the physiological or chemical origins of this disorder? BPD is a very serious chronic personality disorder. Many things can cause or accelerate this disease. One thing is genetics. Although there is no specific gene for BPD, if one identical twin has BPD, there is a 2 in 3 chance that their sibling will have it as well. People with this disease also sometimes have issues with serotonin in their brain, so it can also be caused by a chemical imbalance. Brain structure in general can cause issues with this condition, as it was found people subjected to MRIs that people with BPD had a smaller or unusually active amygdala, used in regulating emotion, especially negative emotion, hippocampus, that regulates behavior and helps self-control, and orbital frontal cortex, used in planning and decision-making. What are the environmental causes of this disorder? Some environmental factors, especially those in childhood, may facilitate BPD. Some examples are physical, emotional, or sexual abuse, exposure to long-term fear or instability as a child, being exposed to neglect as a child, or exposure to a family member who has a serious mental health disorder such as bipolar disorder or a substance abuse problem. How does one know if they have borderline personality disorder? Borderline personality disorder can often be mistaken for being a risk taker or having commitment problems, but there are a few key symptoms for one to decide whether they have borderline personality disorder. Here are a few of the symptoms. Drastic efforts to avoid abandonment, such as rapidly initiating or destroying relationships for the fear of being alone. A pattern of unstable and intense relationships with family and friends, one in which these relationships change drastically from extreme closeness and love to extreme hatred and anger for no apparent reason. Distorted image of self. Impulsive and dangerous decisions and actions, such as unsafe sex, overspending, taking drugs, and binge eating, or an eating disorder, usually that are not associated with a period of high energy or mood. Self-harming behavior, recurring suicidal actions and threats, intense and highly changeable moods, lasting usually a few hours to a few days, feelings of emptiness, problems controlling anger, trust issues, feelings of dissociation, aka not being real, viewing oneself from outside one's body, etc., thinking everyone else is an adult and the sufferer is not, expecting people to parent the sufferer, expecting people to bully the sufferer, idealizing others. All these symptoms are not felt by all people with this disorder, so cases may vary, but these are the tenets of borderline personality disorder. If I have BPD, how do I cure or treat it? Borderline personality disorder has no cure, but can be treated. Some commonly used treatments include cognitive behavior therapy, anger management, dialectical behavior therapy, transference-focused psychotherapy, and schemotherapy. Medication may also be used, but there is no specific medication used for this condition. Therapy can also be given to the family and friends of someone with BPD in order to help them through the mood swings of people with borderline personality disorder. Left untreated, borderline personality disorder can cause eating disorders and suicide attempts. 7 out of 10 people with BPD have attempted suicide, and 50 to 80% of people with it will use drugs or self-harm. What are some beliefs, stereotypes, and assumptions people make about this illness? Borderline personality disorder is one of the most stigmatized and controversial medical health diagnoses to date. The assumptions made about this disorder may negatively impact people diagnosed with it, who may deny that they have the condition and avoid proper exploration and treatment for fear of being judged. People who have this disorder reflect on being treated as if they are difficult to manage, manipulative, or looking for attention. This can intensify the feelings of self-hatred attributed to the disorder. People interviewed have even said that mental health professionals have stigmatized against them. Because this disorder is often seen as causing difficult relationships and mood swings, medical staff may treat people with this disorder as if they are inconveniencing them instead of suffering from a mental illness. Issues are often caused by BPD being categorized as a personality disorder and therefore classified differently than the transient illnesses such as depression due to BPD's ongoing chronic nature. People need to understand that this is a legitimate disorder and therefore difficult to control by the people experiencing it, and its sufferers deserve compassion and care. Borderline personality disorder is often diagnosed through an interview with a licensed and experienced therapist, social worker, or psychologist. They may also perform a physical examination and check family mental health history. Once this disorder is diagnosed, one must seek treatment, because without treatment, people are much more susceptible to other mental illnesses, such as depression, anorexia, or suicidal and self-harming thoughts and actions. To learn more about this disease, you can visit bpd.org, look up the condition on Mayo Clinic or any reliable medical site, observe May as National BPD Awareness Month, and much more. Within our area, one can seek help from any licensed therapist in the area, go to Alcoholics Anonymous meetings for help with addiction. Some people there may also suffer from BPD. Use BetterHelp for online therapy. Seek mental help at the New York Presbyterian Westchester Behavioral Health Center, Borderline Personality Resource Center in White Plains. Visit the Newport Institute in Rhode Island. Attend video therapy with LucidLane.com. Go to the MIND Clinic in New York City. Go to the Weill Cornell Medical College Psychotherapy Center, go to the Haven at Westchester, or attend therapy sessions with people such as Dr. Jose M. De Assis or Dr. Evelyn Atia, MD, for help within the White Plains area.